Assalamu alaikum dear students. Welcome to Dr. Roomi lectures. In our previous session, we studied the regulation of erythropoiesis. Although red blood cell concentration is very finely regulated by erythropoietin hormone, however, in some disease conditions, the red blood cell concentration and oxygen carrying capacity cannot be maintained, as in anemias. Today's topic is anemia, which is one of the most common blood disorders. Anemia can be defined as deficiency of hemoglobin in blood, and this may be caused by too few red blood cells or too less hemoglobin in red blood cells. The cutoff value to label an adult male person to be anemic is less than 13.5 grams per deciliter, and an adult non-pregnant female is less than 12 gram per deciliter, and an adult pregnant female can be called as anemic if her hemoglobin level is less than 11 grams per deciliter. Anemias can be classified on the basis of morphology of red blood cells, that is, the size of red blood cells and their color. So, this is morphological classification, and anemias can also be classified on the basis of etiology, that is, the cause of anemia. First, let's study the morphological classification of anemia, which is based upon the size and color of red blood cells. For this, we need to know the normal mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration. Normal mean corpuscular volume, that is the size of one red blood cell, is between 80 to 100 femtoliters. Any cell which is less than 80 femtoliters will be called as microcyte, and a red blood cell which is having a mean size of 100 femtoliter will be called as a macrocyte. Normal mean corpuscular hemoglobin, that is the concentration of hemoglobin in one red blood cell, is 27 to 33 picograms per cell, and normal mean corpuscular hemoglobin concentration is between 32 to 36 grams per deciliter. These these parameters, that is hemoglobin, MCV, MCH, and MCHC, are included in CBC report or full blood count report, and they are called as red blood cell indices. Mean corpuscular hemoglobin concentration less than 32 or mean corpuscular hemoglobin less than 27 will be called as a cell which is having less color or hypochromic cell. So any cell which is having a size less than 80 femtoliter will be called as microcyte, and a cell which is having less color, which means less hemoglobin, can be represented by mean corpuscular hemoglobin less than 27 or mean corpuscular hemoglobin concentration less than 32 will be called as hypochromic cell. Some important types of anemia on the basis of morphology are normocytic, normochromic anemia, in which the mean corpuscular volume and mean corpuscular hemoglobin, they are normal. Some examples of anemia in this case are anemia in acute hemorrhage, aplastic anemia, anemia of chronic disease, and anemia in case of erythropoietin deficiency, that is renal anemia. In case of vitamin B12 deficiency, the mean corpuscular volume is bigger than normal and the color of cells may be normal. So that's why macrocytic normochromic anemia may be seen in case of B12 deficiency. In case of folic acid and B12 deficiency, the cells may be bigger in size and sometimes the color may be less than normal. So it means macrocytic hypochromic anemia may be seen in case of folic acid and B12 deficiency. In case of iron deficiency, the cells are smaller in size, that is microcyte, and also they are having less color or less hemoglobin. So the cells are microcytic hypochromic cells. On the basis of etiology, there are 5 types of anemia: hemorrhagic anemia, hemolytic anemia, nutritional deficiency anemia, aplastic anemia, and anemia of chronic disease. In case of acute hemorrhage, there is sudden loss of large quantity of blood, for example, in case of road traffic accident. In case of acute hemorrhage, the fluid portion of blood will be replaced in 1 to 3 days. However, the red blood cells, because they will be relatively less, so the blood will be diluted, and the red blood cells, they will be normocytic, normochromic. In order to fulfill the deficiency of red blood cells, erythropoietin is produced from kidneys, which stimulates bone marrow, and this deficiency of red blood cells will be corrected in acute case within 3 to 6 weeks. In case of chronic hemorrhagic anemia, there is loss of blood internally or externally over a long period of time. Some important examples of chronic hemorrhagic anemia are bleeding from peptic ulcer, bleeding from colorectal cancer, or excessive menstruation in females, or bleeding in case of hemophilia in boys. Because of loss of blood chronically, there is iron deficiency and it leads to less production of hemoglobin. So over a long period of time, red blood cells become smaller in size because they're filled with less hemoglobin. So this chronic hemorrhagic anemia has iron deficiency in it and it's of microcytic hypochromic type. On the basis of etiology, second type of anemia is hemolytic anemia. In this case, the red blood cells are fragile and they are easily ruptured when they pass through tortuous narrow capillaries of spleen. The lifespan of red blood cells is shorter in this case and they are destroyed faster than their rate of production. Hemolytic anemias may be extrinsic or intrinsic. Extrinsic hemolytic anemias are caused by factors which are outside of the red blood cells. For example, some antibodies which can destroy red blood cells, as in case of autoimmune diseases, some chemicals, drugs, and malarial parasites can destroy red blood cells. And also when spleen is overactive and removes more red blood cells and destroys them, this is called as hypersplenism. Intrinsic hemolytic anemias are because of defective red blood cells which are caused by some inherited disorders. For example, in case of hereditary spherocytosis, Thalassemias, sickle cell disease, pyruvate kinase enzyme deficiency, and glucose 6-phosphate dehydrogenase enzyme deficiency. We will discuss some of these hemolytic anemias in a little bit detail. First, hereditary spherocytosis. In this case, the red blood cells, they are spherical, not like a biconcave disc. So these cells, they are more fragile. When they pass through the capillaries of spleen, they cannot squeeze easily and they are ruptured. The red blood cells in case of hereditary spherocytosis are smaller in size, which means less than 80 femtoliter. So some important conditions in which red blood cells are smaller in size are iron deficiency anemias, thalassemias, and in case of hereditary spherocytosis. 0.3 to 1% of the Western African and American blacks have sickle cell anemia. In this case, there is point mutation in which hemoglobin becomes abnormal, which is called as hemoglobin S. Normally, there are two alpha and two beta chains. In hemoglobin S at position number 6, amino acid glutamic acid is replaced by valine, and hence the hemoglobin becomes less soluble within the cytoplasm of red blood cells. This hemoglobin is more likely to precipitate in hypoxia. So whenever these people are exposed to hypoxia, the hemoglobin is precipitated. It makes elongated crystals of hemoglobin and hence the red blood cells becomes sickle shaped. These sickle shaped red blood cells are more likely to rupture the cell membrane. And also these sickle shaped red blood cells, when they're passing through capillaries, they are more likely to clump. And hence the blood flow can be further impeded, which may lead to pain in those areas where blood supply is affected. Sometimes in these patients, vicious cycle of events may start in which hypoxia can lead to sickling of the red blood cells, which rupture when passing through the spleen, and also there is clumping of these cells in narrow vessels, which further leads to more hypoxia that further increases sickling process, and this leads to a serious decrease in the count of red blood cells within hours, and this is called as sickle cell disease crisis, which can be fatal. Interestingly, these people having sickle cell anemia are more likely to survive malaria because these red blood cells having abnormal hemoglobin, they have a shorter lifespan, they are more likely to break when they're passing through spleen, and hence if they are infected by malaria parasites, they will not allow enough time to the malaria parasite to complete their cycle, and hence the malaria parasite cannot reproduce and cannot spread in the body. So that's why these people are more likely to survive an attack of malaria. In case of erythroblastosis fetalis, Rh positive red blood cells of the fetus are attacked and destroyed by IgG antibodies of the mother who is Rh negative. These antibodies pass through the placenta of the mother and enter into the circulation of the fetus. When the fetal red blood cells are coated by the IgG antibodies of the mother, then these red blood cells, they become more fragile and they are destroyed in the spleen. So because of hemolysis, as there is anemia in these fetuses, there is rapid attempt for the erythropoiesis, because of which even the earlier primitive nucleated red blood cells from the fetal bone marrow enter into his or her circulation. So that's why this condition is also called as erythroblastosis fetalis, which means in the fetus there is such a rapid attempt for making the new red blood cells that the erythroblasts, which are nucleated primitive red blood cells, they enter into the circulation. Thalassemias are also hemolytic disorder In this case, the red blood cells are also smaller in size, like iron deficiency anemia. This disorder is more common in Thailand and in the countries of Mediterranean region. In case of thalassemias, there is imbalance between alpha and beta polypeptide chains. Normally, alpha chains are equal to beta chains. So, in each molecule of hemoglobin, normally there are two alpha chains, two beta chains. If there is deficiency of alpha chains, then this is called as alpha thalassemia. And if beta chains are deficient, then this is called as beta thalassemia. So if one chain is deficient, the other chain may be more. And hence, because of this, the extra chains of hemoglobin. So because of this balance, the extra polypeptide chains of hemoglobin, they may be precipitated within red blood cells, and these red blood cells are hemolyzed. Another etiological type of anemia is nutritional deficiency anemia, and some important subtypes in this case are iron deficiency anemia, megaloblastic anemia, which may be seen in case of vitamin B12 deficiency and folic acid deficiency, and protein deficiency anemias. So first we will talk about iron deficiency anemia. This is the most common type of anemia. In this case, there is less availability of iron for hemoglobin synthesis, and red blood cells are smaller in size, that is microcytic, and also having less hemoglobin are low in color, which means hypochromic. So microcytic hypochromic anemia is typically iron deficiency anemia. Some important causes of iron deficiency anemia are chronic loss of blood. For example, an old person losing blood in his stool if the person is having colorectal cancer, and a lady who is having excessive menstruation. It can also occur in a case when someone is not absorbing enough iron from the intestines. So there is problem with absorption. For example, a person having a hookworm, which decreases the iron absorption. Iron deficiency anemia can also occur in some conditions when the person is not taking enough iron in diet, but there is increased demand. For example, during pregnancy and also during increased growth, for example, in children. In case of iron deficiency anemia, iron level, ferritin level, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, and mean corpuscular volume are all decreased. In megaloblastic anemia, there is either deficiency of vitamin B12, folic acid, or intrinsic factor. In this case, there is maturation failure. There is less synthesis of thymine nitrogenous base, hence less DNA synthesized, and the red blood cells, they cannot divide and cannot grow properly. Not only the red blood cells are affected, but also the maturation of white blood cells is affected. In megaloblastic anemia, the red blood cells are large in size and also they are odd shaped. And also the WBCs, their count is decreased. In the peripheral blood film, the number of lobes of the neutrophil are increased. Normally, neutrophil, they have 2 to 5 lobes in the nucleus, but in this case, the number of lobes is increased, which is called as increase in Arnett count. Some important causes of vitamin B12 deficiency are pernicious anemia. In this case, there is destruction of the gastric parietal cell by the autoimmune process. So these cells which produce intrinsic factor for the absorption of vitamin B12 through the ileum of small intestine is deficient, and hence vitamin B12 deficiency occurs. Also, a person who is having cancer of stomach, if we do total hysterectomy or total removal of the stomach, once again the intrinsic factor will be deficient. Vitamin B12 deficiency can also occur in a person who is having intestinal sprue or malabsorption problem, and some people who use poorly cooked fish, the fish tapeworm can also cause deficiency of vitamin B12. And purely vegetarian person who do not eat meat can also have vitamin B12 deficiency. Pernicious anemia, which is an autoimmune disease, is more common in females than in males, and it is more common in old age. Pernicious anemia is called pernicious because previously, a long time ago, we didn't knew its cause, and it was very difficult to treat it. And in most of the people, this was a fatal disease. Megaloblastic anemia can also be seen in people who are having folic acid deficiency. However, the difference between vitamin B12 deficiency and folic acid deficiency anemias is that those who are having vitamin B12 deficiency, they are also having neurological problems. For example, they may have burning feet, tingling and numbness in their limbs and especially hands and feet. These people may also have incoordination of muscles called as ataxia when they're walking. It's especially important to note that folic acid is very important vitamin which is required during pregnancy, and females who are pregnant are given zero point 0.4 milligram or 400 micrograms of folic acid per day in the first trimester of pregnancy. Another type of anemia is aplastic anemia. Here, aplasia means lack of functioning bone marrow. Although all the necessary nutrients required for normal erythropoiesis are available here, but the bone marrow cells are not dividing. Some important causes of aplastic anemias are exposure to high dose radiations. Some important causes of aplastic anemias are exposure to high dose radiations, for example, X rays, gamma rays. This may be use of radiotherapy for the treatment of cancer or exposure to radiations during nuclear explosions. Some other factors like chemotherapy, which is used to treat cancer, and also insecticides, benzene in gasoline, some drugs, viral infections, and also some autoantibodies can destroy the bone marrow cells, and hence they are not dividing, and it will decrease the production of new red blood cells. In such conditions, there may be selectively decreased production of red blood cells, or the other types of blood cells can also be decreased. When all the other cells are decreased, which means red blood cells are decreased, platelets are decreased, and the white blood cells are decreased, this is called as pancytopenia, which means the production of all the blood cells is decreased. Some treatment options for aplastic anemia are blood transfusions, which can temporarily increase the red blood cell count. Another treatment option is bone marrow transplantation. Another type of anemia is anemia of chronic disease. This is the second most common type of anemia after iron deficiency anemia. In this case, red blood cells are normocytic, normochromic. This type of anemia develops several months after chronic disease, for example, tuberculosis and rheumatoid arthritis. And in this case, the mechanism may be resistance to the action of erythropoietin or disturbance in iron metabolism. Now let's talk about the effects of anemia on body. The skin and mucous membrane of anemic people are pale. This paleness can be well observed in the mucosa of our mouth, like on tongue, the conjunctiva of our eyes, lips, hands, and the nail beds. In case of iron deficiency anemia, nails are brittle and spoon shaped. This condition is called as koilonychia. In the lips, there may be fissuring. This is called as cheilitis. And also at the angles of mouth, there may be inflammation called as angular stomatitis. And there may be difficulty in swallowing called as dysphagia. In case of aplastic anemia, because white blood cells are also low, so necrotic lesions may appear in the mouth and pharynx. In case of pernicious anemia, there is atrophy of papillae on the dorsal surface of tongue, and the skin color is lemon yellow. It's because of anemia combined with mild jaundice, because there is also increased breakdown of red blood cells. Anemias also have effects on cardiovascular system. When red blood cell concentration is decreased, this decreases the blood viscosity, because most important factor which affects the viscosity of blood is the red blood cell concentration. So when blood viscosity is decreased, then the resistance to blood flow is decreased. Moreover, in case of anemia, the peripheral blood vessels, especially arterioles, dilate. This also decreases resistance. And when the blood vascular resistance will decrease, there is more blood which is returning towards heart. So venous return of blood towards heart will increase. And according to Frank Stalling mechanism, more is the venous return, more will be the pumping action of heart. So heart will increase at a faster speed and with more force, hence the cardiac output will increase. So in this case, the circulation will be hyperdynamic, and some murmurs may be noted in case of anemia. Because of rapid and fast contractions of heart to pump more blood, patient may feel palpitations and the workload of heart is increased. This increase in cardiac output can partially overcome the decrease in oxygen carrying capacity of blood in anemia. However, these people who are having severe anemia, if they start doing exercise, there is further increase in demand of oxygen by the body, and it may become difficult for the heart to further increase the cardiac output and blood flow. Hence, these people they may start having chest pain or angina, and acute cardiac failure may also start. Respiratory system also shows some signs and symptoms of anemia. For example, there is increase in rate and force of respiration. In case of activity, anemic person is more likely to have dyspnea or breathlessness. Oxygen hemoglobin dissociation curve shifts towards right side, maybe because of increase in 2-3 dpg level, so that oxygen can be easily delivered to the tissues. Anemic people may also be fatigued and feel weakness most of the time, and also their hands and feet may feel colder than a normal person. In order to diagnose a specific type of anemia, it's important to look at the age, gender, the signs and symptoms, and also the blood indices of the CBC report of the patient. Let's suppose a 30-year-old female from a poor socioeconomic background is a mother of 5 children who presents to a physician's clinic. She presents with the problem of fatigue, weakness, palpitation, and shortness of breath. On examination, her skin is pale. She is having angular stomatitis. Doctor advises the complete blood count, and her hemoglobin is found to be 7, mean corpuscular volume and mean corpuscular hemoglobin is also decreased. This is a typical example of iron deficiency anemia. So it means you need to look at these parameters, that is age, gender, specific signs and symptoms of the patient, and also the blood indices in order to reach to a diagnosis. In order to confirm the diagnosis, some further investigations may be required. For example, in this case, sometimes the iron level, the ferritin level, iron binding capacity, and sometimes bone marrow examination may be required. However, it's important to note that the treatment of each type of anemia may be different, and that depends upon treating the specific cause of a specific type of anemia. Today we have studied anemias in which red blood cell count is decreased. In our next session, we will study the problem of polycythemia in which red blood cell count is increased. Thank you so much for watching this video. See you next time with another video.